My skin story is a story. Everyone I meet, I want to know the why. What makes you special? What makes me good at what I do? Why La Chalet and why medical aesthetics? And for me, it was really based down to my own skin story. It was based to being a child who suffered from severe acne, someone who suffered from self-esteem, confidence, and went through life kind of with my head down, covering my cheeks so that no one could see my skin. Always standing in the back of pictures, because when your skin's awful and you're ashamed of what you look like, it affects who your character is. It affects your ability to look confident. And I have the most incredibly supportive parents. They always taught me it doesn't matter what's on the outside, it's what's on the inside. It's who you are that matters, not what you look like. And while I completely agree with them, at the same token, as I've aged, I have seen people with better skin have higher salaries. People with better skin, their studies are promoted more. People with better skin are more confident, and that confidence leads to opening themselves up to more relationships. So skin matters. And from someone who didn't have good skin, and I would look at people and look at their skin, and all I would do is, gosh, I can't imagine being her, that she could wake up and just not have to put 10 pounds of makeup on to cover all of her acne and her scars. And so that inner, you can't change someone. That was half my life, was that Lisa. And now for me, this is not a job. This is truly my passion, because I know that I can give people more confidence, that maybe their story is similar to mine. Everyone has a story. When I first came into the aesthetic field in 2007, every patient would come up to me and say, I know I'm being vain, I know I'm a bad person, I shouldn't care what my skin looks like. And it would kind of bother me, and that it's okay what the kitchen looks like, it's okay what your car looks like, it's okay what your handbag looks like, but God forbid, somehow society's made it out that if our skin doesn't look good, that we're bad people, that we shouldn't feel that way. And I think what's really beautiful about this next generation, such as my daughter, who is now, a young adult, is that they are very into self-care versus the generation of 50s to 80s currently. And they do proactive things for their own self-care. And so that rhetoric's kind of changed, which is really great. And I feel that part of my duty is to educate people that it's okay to care for yourself. It's okay to care for your skin. I also feel that I'm very fortunate that I've been in the industry for 20 years. It's just a lot of knowledge that you can't gain in a weekend. And so for me to be able to share that knowledge with my team, for me to be able to share that knowledge within the industry, to help shape the industry to stay true to its power, which is really empowering men and women. It's really just little things that can make a difference. You don't have to do drastic things to build confidence. It can be a simple brown spot, a simple line, and people's faces light up when they come here at La Chalet. And so my commitment, and the reason every Saturday night I pick up a medical journal, and the reason I go around the world with other key opinion leaders, and I find that I have a duty to be involved in how aesthetics will shape, I feel proud of that, because I want to make sure it stays true to the real art of natural beauty that I feel that non-invasive medical aesthetics provides. The treatments here that we do at La Chalet are truly transformative in nature. I think what's so amazing about it is they are helping our patients have more confidence, more self-love, and in turn this leads to having more fulfilled lives and happier lives. While I was at UCLA, I had one of my first loves, and it was a big box the size of this room, and it was a laser. I always loved physics, but I had never known that physics and skin and artistry could all be mixed in together. And as I started to go my own personal transformative journey of clearing my acne, then after that phase, clearing a lot of scarring, it was through lasers. It was through medical devices, energy devices. And so that really is a whole separate subspecialty of aesthetic medicine. Many people don't know there's the art of just injecting, and then there's the art of laser medicine. And they're really hard to learn all that. You really have to love physics. You have to love optics and wavelengths and energy and watts. And so it's super cool and exciting for me that I get to use that science background in STEM. And part of the reason I really try and tell people, and I speak in a lot of schools about STEM and about bringing how the science blends with laser medicine. Here at La Chalet, we have a lot of lasers. My husband gets irritated because every week I seem to be getting another one. And so it's difficult, but they all play a different role in someone. So it's kind of like saying, okay, I want to build this house, but I only have one screwdriver, or I only have a hammer. And so there is a lot of tools. And while a lot of the lasers are FDA'd for a lot of different treatments, they all have a superpower. So that one laser may be very, very good at superficial scars. One might be better at deeper. One might be better with reds, blood vessels, another with brown spots. Another that has just great new data on collagenesis or preventing future skin cancers. And so I think that's why I get so excited by lasers. I think that that's why I want to try every single one that comes out. I end up really speaking and getting involved in some clinical research with lasers because I really think that you can't have natural results and just cut skin off and just inject and plump faces without focusing on the root cause of aging with that skin. I think the future is going to be aesthetic hacking. And people say, what do you mean by aesthetic hacking? And I'm really into longevity realm right now. And we're studying gene therapy and how can we go in and prevent cells from aging? How can you just stop everything? Because no one wants to live to 100 if they don't cognitively have their memory. And no one wants to live to 100 where they feel their body is just deteriorating. So there is a lot of focus now on aesthetic hacking. How can we prevent our hair from turning gray and falling out? How can we actually slow down the onset of menopause? How can we prevent the wrinkles from really forming as quickly and robustly at a younger age so that we don't have to do drastic measures when we're older and hit 60 or above? And so that's really a lot of where I'm focusing my energy right now and looking at startup companies, and I'm having meetings every week on what is the future of aesthetic hacking. And so we're doing it here without us really knowing it already at La Chalet. We do it because we have people coming in that are younger and they're very educated. And they're very knowledgeable. And they're saying, I don't want to have surgery someday. I don't want to look like this. And so what can I do now at 30, at 40 to prevent that? And so we custom make amazing programs where we know we don't build collagen past 25. So what can you do to keep your collagenesis and that skin metabolic pro-elastin, pro-growth, without just saying, oh, I'm older, there's nothing I can do. And so we're doing it every day here. We're doing it because we are blending energy, lasers, and injectables to really prevent aging. And it's working. You know, there's a lot of people like me who are over 50 now, and we've grown up with this since our 20s. And so while we're all aging and there's new wrinkles I don't like and new spots, at the same token, I think if you look at an average 50-year-old from 40 years ago, they don't look like a lot of the average 50-year-olds that come to La Chalet. And I'm really proud of that. I'm really proud that we are all aging. I embrace it. I'm blessed every day I'm a year older. But yes, do I want to put a little stop sign to my aging process? I do. Do I want to prevent my need for ever needing a surgical intervention someday? I do. I'm not against it, but would it be great if I never needed one? It would. So that's really another kind of focus I have.